tells it.
Oh, it is, I know, right? It's like one of those, you want to know somebody who owns a boat, you never want.
Absolutely, you want your best friend to own a boat.
Yes, 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 yes. It's 8:16 in the morning. It's what vacation nightmares are made of. Dr. Chaffoo is joining us this morning to how avoid getting sick if you're taking the cruises this summer, because the cruises are fun.
They're a lot of fun.
But often we hear about the big norovirus and then the whole ship gets sick.
Yes.
So why does this happen on cruise? What is a norovirus and why does it happen on a cruise ship?
Well, Shally, the reason it happens is we're in closed environments for days on end. We're sharing, washing facilities. We're sharing food utensils, common areas for food. And so it's very, very easy for some contamination or some virus of some kind, or bacterial infection for that matter, to get spread very rapidly and quickly in such an environment.
Is there anything that you could do before you board a cruise to prevent getting sick, or?
Well, there are certain viruses we know we can be immunized against. For example, hepatitis A, influenza, the flu virus, and measles. But the most common cause of shipborne illnesses when people become ill is a norovirus, which is a virus for which there is no immunization.
Okay, so there are some things though that you say that you can do, maybe if you're on a cruise or you're getting ready to go on a cruise, to pay attention to some information. What are the things you do have control over?
Sure, so what you have control over is research. You can go on the CDC's website and look at the the vessel sanitation program and how well they're doing. They have that. For ships of more than 13 passengers that have a foreign itinerary that are also visiting a U.S. port, you can actually go on and you can look at the cruise ship's record.
Oh, I didn't know that.
Yeah, so you want at least an 85 or higher on those reports. It makes it a little bit safer, obviously. When you're on the cruise ship, you want to wash your hands frequently, like we've talked about before, with soap and water, not the sanitizing lotions. They're not really antibacterial.
You really want to get in there.
You want to get warm water and wash your hands. You want to really watch out if you see someone is ill there. You want to report that probably to one of the people on the boat, one of the medical staff, if you're ill yourself. And you want to be careful and make sure that you're looking around and you're observant. Are the staff cleaning the bathrooms frequently? Is the trash getting emptied? If you get a peek inside the kitchen, does that look relatively clean? So like you would do if you went into a restaurant. You just need to be aware.
I've been on 2 cruises. One was in Europe and one was right here off this coast.
San Diego, right?
Yeah, and I remember one of the parts that kind of shocked me was the food. Like everybody's hands are in those.
That's a
food
no-no,
buffets.
exactly.
And then the kids, they were taking food, putting it in their mouth, putting it back in.
It's so difficult because, of course, my kids the same way. But I mean, you really want to use those utensils and be very cautious.
But even using those utensils, Dr. Chaffoo, if somebody touches that.
You're quite right, because that norovirus, Shally, is highly contagious. It can be obtained from aerosol, from coughing, but certainly from just being on a surface, a contact surface.
Okay, so what's the overall takeaway before I want to get to this moms and the diabetes and autism risk. What is the takeaway from the overall cruises? Just wash your hands.
Wash your hands. Do your research. Look at their many cruise lines, and the vast majority of them, of course, you don't get these illnesses.
They don't.
But you need to be cautious.
Most
as a
of them
consumer.
do a very good job keeping their ships clean and trying to protect their passengers on it. Okay, a new study, a mom's diabetes can raise her risk of her kids possibly having autism. This was concerning for me because I did get gestational diabetes with my 3rd pregnancy. Does it apply for full diabetes, gestational? What does the study say?
Shally, it's a fascinating study. I read the study actually, and there was a study in Southern California of Kaiser Permanente, and they studied about almost 400,000 women that had gestational diabetes. And what they found was, in those women that got gestational diabetes before the 26th week, their incidence of the child actually getting autism spectrum disorder, called ASD, was increased 43%.
43%?
Yes, but here's the kicker. It's not a cause and effect. There is an association, if you will. So we know, for example, that there is an increased risk of neurodevelopmental disorders in women that obviously have high blood sugars, from diabetes, maternal obesity, hypertension, but we haven't seen a cause and effect relationship. The next study they're going to do.
How do they do that, though?
Well, what they found was, in the same study, they found that women that actually developed gestational diabetes after the 26th week, their kids did not have an increased risk for autism.
I see.
So there's,
Okay.
we don't see a cause and effect relationship, it's an association. The next arm of the study needs to be looking at, well, once we've diagnosed women with gestational diabetes and we treat it, are those children at an increased risk? So much is unknown about the autism spectrum disorder. Obviously, we know it's multifactorial.
Right.
It's a complicated neurodevelopmental disorder, and more research needs to be done so we can make some better recommendations.
Dr. Chaffoo, thank you.
Thank
Good
you.
information.
Good to see you.
All right, 821 prescription.